Welcome back. Today, we're tackling a topic that affects millions: joint pain. There's a lot of misinformation out there, and what you believe about joint pain can shape how you manage it. My goal? To bust 8 common myths that keep people from living their best, most active lives. We'll cover everything from exercise and knuckle cracking to weather changes and surgery. By the end, you'll know what's fact, what's fiction, and how to take control of your joint health. Ready to separate myth from reality? Let's get started. Here's myth number 1. The biggest myth out there when it comes to aging? It's the belief that joint pain is just a normal, unavoidable part of getting older, that it's something everyone must simply accept. Sure, joint issues like osteoarthritis do become more common as we age, but that doesn't mean they're guaranteed for everyone. In fact, many people never develop significant joint pain at all. Factors like your genetics, how active you are, your weight, and whether you've had injuries in the past all play a much bigger role than age alone. Lifestyle choices can make a huge difference. In fact, plenty of people live well into their 80s and 90s with little or no joint pain. They stay active, manage their weight, and make caring for their bodies a priority. These habits help keep joints healthy and strong. When you believe pain is inevitable, it's easy to give up hope or avoid seeking help. This mindset can lead to resignation, isolation, and missed opportunities for effective treatment or prevention. Remember, joint pain is a symptom, not a life sentence. It's your body's way of telling you something needs attention, not a sign that you have to stop living fully. There are many proven ways to prevent, reduce, and manage joint pain, no matter your age. From exercise and physical therapy to weight management and medical treatments, options exist for everyone. Don't accept pain as your destiny. Take action, talk to your doctor, and explore what's possible for your health and comfort. Age is a risk factor, not a diagnosis. It's just one piece of the puzzle, not the whole story. When you reject the myth that pain is inevitable, you open the door to better mobility, greater independence, and a more active, fulfilling life. So, let's move on to the next myth and keep challenging what we think we know about aging. Exercise and joint pain. What's the real story? Let's find out together. Many people worry that exercising will only make their joint pain worse, especially if they already struggle with stiffness or discomfort. It's a common fear. After all, when something hurts, our instinct is often to rest and avoid movement. But in reality, for most chronic joint issues, the opposite is true. Regular, gentle movement can actually help reduce pain and improve how your joints feel and function. Our joints are designed for movement. When you move, it stimulates the production of synovial fluid, which nourishes cartilage and helps keep joints healthy and lubricated. This natural process is essential for joint health at any age. On the other hand, inactivity can actually make things worse. Sitting still for long periods causes muscles to weaken and joints to stiffen, which can increase pain and make it harder to move over time. This creates a vicious cycle that's tough to break. Exercise helps by strengthening the muscles that support your joints, which reduces the stress placed directly on them. Stronger muscles act like shock absorbers, protecting your joints from everyday wear and tear. The key is to choose the right kind of exercise. Low-impact activities that are gentle on your joints but still keep you moving. Some of the best options include swimming, which takes pressure off your joints while letting you move freely. Cycling, which builds strength without pounding your knees or hips. Walking, which is simple and effective. And yoga, which improves flexibility and balance. Tai Chi is another excellent choice, combining slow, controlled movements with deep breathing to enhance joint mobility and reduce pain. If you're just starting out, remember to begin slowly, listen to your body, and gradually increase your activity level as you feel comfortable. It's normal to feel a little sore at first as your body adjusts to new movements, but this mild discomfort usually fades as you get stronger. However, if you experience sharp or persistent pain, it's important to stop and adjust your routine, or consult a healthcare professional for guidance. Remember, inactivity is the real enemy when it comes to joint pain. Movement is your ally, helping you stay mobile and independent. The best exercise is the one you enjoy, whether it's dancing, gardening, or playing a gentle sport. Make it a regular part of your life. Exercise is one of the most powerful and natural tools for managing joint pain and improving your quality of life. Don't let fear or old myths keep you from moving forward. Every step counts. Next up, should you avoid all activity if you have joint pain? Let's bust that myth and set the record straight. Here's what you need to know to stay active and protect your joints for years to come. Some think all movement should be avoided with joint pain, but that's a mistake. Avoiding activity leads to stiffness, muscle loss, weight gain, and even more pain. Gentle, regular movement keeps joints flexible and maintains muscle strength. Even small changes, walking around the house, stretching during TV, taking the stairs, add up. Every extra pound adds pressure to your joints, so staying active helps manage weight and pain. Sedentary habits also affect mood and sleep, making pain feel worse. The goal is to keep moving throughout the day, not just during exercise. For chronic pain, consistent gentle activity is key. Complete rest is only for acute injuries, not ongoing joint pain. Don't let fear of pain keep you still. Movement is medicine. Now let's tackle a classic. Does cracking your knuckles cause arthritis? Time to pop that myth. Here's the truth. Stop cracking your knuckles. You'll get arthritis. We've all heard it, but it's simply not true. The popping sound is just gas bubbles in the synovial fluid, not bones grinding or damage. Studies, including a decades-long personal experiment, show no link between knuckle cracking and arthritis. At worst, excessive cracking might cause minor swelling or reduced grip strength, but not arthritis. Arthritis is caused by factors like age, genetics, weight, and injury, not by cracking your joints. If it's not causing pain or swelling, there's no need to worry. The myth is officially busted. Let's move on. Is medication the only answer for joint pain? Here's what really works. Let's break it down. Medication can help manage joint pain, but it's not the only, or even the best, solution for most people. While it's common to reach for a pill when pain flares up, relying on medication alone can actually limit your progress and may even mask underlying issues that need attention. Relying solely on pills ignores safer, more effective strategies that can address the root causes of joint pain and improve your quality of life in the long run. Long-term use of painkillers, especially in seniors, carries risks like stomach issues, kidney problems, and addiction. Over time, these side effects can become serious, sometimes leading